Hi, everyone. I'm Drew Schiller, co-founder and CEO of Validic. Really excited here today to talk to you about what's happening in digital health and consumer engagement. As we all know, before the pandemic hit, healthcare was having a lot of sort of fits and starts with digital health and how to really engage consumers. But what we've really seen over the last 18 months is that the entirety of not only how we see healthcare, but how we see our lives has been virtual, including what we're doing here today with this virtual panel presentation. And so, what I'm really excited about today is to have a conversation around how that has changed and is changing the way that consumers interface with healthcare, and conversely, how healthcare is actually starting to interface with consumers in new ways. As mentioned, I'm the co-founder and CEO of Validic, which is a healthcare company that connects data from in-home monitoring devices and brings it into healthcare systems to enable remote monitoring and virtual care at scale. And I'm also the chair of the Consumer Technology Health Division. And with me today are some fabulous panelists, and I'll allow them to introduce themselves. Why don't we have Sammy, and then Sarah, and then Tom? Go ahead and give quick 2 minutes on your background. What is exciting to you right now about healthcare in this space?
Well, thank you, Drew. Yes, this is Sami Inkinen, CEO and co-founder of Verta Health, and we are a telemedicine company on a mission to reverse, yes, indeed, reverse type 2 diabetes in 100 million people. And I co-founded Verta about 6 years ago. My background is actually in physics. I'm a physicist by training, and prior to Verta Health, I was truly in consumer tech. So I co-founded a company called Trulia. And so those of you who use Trulia Zillow, I founded Trulia 2004. So while not a doctor, I bring a lot of, I guess, technology expertise and consumer focus to healthcare, and excited to be part of the panel.
Thanks, Drew. Thanks, Sammy. I'm Sarah Richardson. I'm SVP and CIO for Tivity Health. We are most known for Silver Sneakers. It's a brand for Medicare Advantage seniors that brings fitness and wellness solutions into the home. We have 18 million members, and very excited always about the ability to combine the wellness and the fitness and the hospitality aspects of what we do in our industry. That's my background, 7 years in hospitality, 22 now in healthcare, and also a certified personal trainer, among other random hobbies that really focus on the fitness and wellness and opportunities that we have to help people live longer, healthier, independent lives.
Hi everyone, my name is Tom Waller. I am a human performance technology specialist. I was formerly the Chief Science Officer and Head of Advanced Innovation at Lululemon. In the capacity of this conversation, my expertise is really about how technology can enhance human performance and how that can be applied to all disciplines of performance, inclusive of well-being. And particularly in my previous role, that was a major focus for how do we understand the human experience of performance when well-being is a desired outcome. My history is as a PhD in sports technology, so I've been dedicated to sporting goods, health, fitness, and well-being for a couple of decades now.
Awesome. Thank you so much, Tom and team. Really appreciate those introductions. And Sammy, I wanted to start with you specifically in your mission to reverse type 2 diabetes with Verta, which is, it's been inspirational since you launched, and it continues to be that today. And what's most inspirational is that you're actually seeing success. And what I wanted to get your take on from a consumer perspective is what is your take on consumer pull on these programs, and how much consumers want to really participate in these programs themselves versus provider push, right? Where these programs are patients are being enrolled in these programs as part of a standard of care. I'm just curious, what do you see in terms of efficacy and engagement and self accountability from patients? Is it better when people sort of self-select into these programs? Do you need to see a combination? What do you see on the consumer side there?
Yeah, absolutely. And first of all, you mentioned we reverse type 2 diabetes and have seen strong results. So that may be a new concept for some listeners. So it literally means that we take a chronic progressive disease such as type 2 diabetes and reverse it to the point that people who have been on drugs like insulin get off of it, and they're actually metabolically healthy and they don't anymore have the disease. So indeed, it is possible at scale. But more specifically to your question, well, Well, first of all, in healthcare, I don't think you can force anything on people. So, the premise of the question is people have to opt in. Even if you go and see your primary care doctor and they say, hey, you should do this, so be on that. Just to give you one statistic, half the people, for example, living with diabetes, type 2 diabetes, when a provider says you have to be on insulin, half do not want to do that. So that just goes to show that you really can't force people. This is, I don't know if this is appropriate to say, but this is United States. This is not North Korea. So you can't force people. So you have to have something that people want to opt in. And so at least in our case, it comes down to the most important thing is product market fit, not some tricks and financial incentives. You can layer those types of things on top of it. People have to want to do something. And in our case, it comes down to this promise. Hey, you've had diabetes for a year, 5, 10, 15, 20. Did you know that you don't have to live with it? And you don't have to be a super person, super willpower. We have, medically supervised program with evidence that we can reverse that, make you healthy, make you feel better. So the most important thing is to realize that you can't force anything on people. It's opt in. And then 2, before you start layering fancy technology and AI and shiny user interfaces and incentives, you have to make sure that the product market fit, what you're actually offering, the value proposition, is so powerful that most people raise their hand and say, are you serious? Okay, so you can reverse diabetes. Like, how can I do that? And you're telling me it's free? My employer helpline pays it. And so we actually see very, very high engagement. I think that's the foundational thing. And then you layer with all the, smart digital marketers and incentives and all other things. But you can't put kind of the tactics and techniques ahead of the fundamental product and service that you're offering to users.
Absolutely. Sarah, Tom, I'm curious to get your perspectives on that as well, in terms of how people get engaged with these programs. And I think Sammy makes a great point, which is, we are very much a country based on freedom of choice here, and really you can't force Americans to do things. So how do you think about engaging folks in these programs and getting them to sort of take ownership and signing up?
Sarah, would you like to go first?
No, please do.
Oh, thank you. It was really interesting what you were saying. People do have to want to do things, and I think I come from very much an environment where we're not talking about health conditions, we're talking about health aspiration when it comes to activity and well-being. And one of the things that we know very, very clearly is knowledge is not power in this sense, and motivation is actually not enough. The behaviors that we see that end up, delivering the outcome of health or performance, they have to have absolutely a motivation, but a motivation without an ability is not enough. And a motivation without ability and without a prompt is also not enough. So having all of those 3 things together and knowing how to bring those things to life, particularly around for us those brilliant basics of exercise, sleep, a good diet, and relationships. All of those things can be utilized in order to get to that outcome. Because I think what we find often is that knowledge is where we go, and we use knowledge to motivate. We all know we shouldn't eat too much cake, but we still do. We all know we should sleep a little bit more, but we don't. So knowledge and motivation are a really challenging singularity or singular focus, because the power of the community, the power of tiny behaviors and how they interact in our day-to-day moments and anchor to those moments in life, they seem to be they're not quite as sexy, but they definitely work. And so thinking just through the lens of how do healthy people get healthier, there's probably some really good reverse engineering into how we can then approach people that maybe have a condition that are seeking to that incredibly exciting outcome, which is to reverse a disease condition.
Absolutely. Yeah, I'll say on my side, we certainly see with some of the remote care programs that we implement, there's a real virtuosity or sort of virtuous thing that happens when you have the care teams involved with the consumers, the people themselves. as well as with the technologies at Bridge. So for example, with Kaiser Permanente, we have the largest remote monitoring program in the country. Almost 250,000 people have been enrolled in that program, deployed across 7 regions of Kaiser. Thousands of physicians have enrolled patients in the program, and really strong clinical results and engagement. I oftentimes get asked, with these programs, are they successful because the providers and nurses in these programs are enrolling the people directly? Is it because the technology is uniquely good? Is it because people are sort of taking their medication more regularly when they're in these programs? And I'm like, yes, it's the whole virtuous cycle, because the person, a lot of times these people who are living with chronic conditions, they typically feel like they're kind of out on a limb on their own, and they don't have any other option. Like, they don't know what to do. They're trying to be healthy and they're being unsuccessful. And so being enrolled in these programs and having care teams that are supportive and they understand what their role is, and then knowing that if they just take their device readings, they're going to be participating in the program and be successful. And if there's anything concerning, it'll be raised up. And then they also know that, when they're taking their readings on a regular basis, whether it's for hypertension or, COPD or diabetes, et cetera, they know that, when I take my medicine, my numbers are more regular. So they take their medication more. So it's like this commitment device of the technology. But it's all wrapped up in the program of like the person ultimately feeling empowered and supported to participate in the program. So I think it's a really important sort of self-selection point. Sarah, anything else to add on this one? And then, because I want to turn to you next with my next question as well.
Well, sure, absolutely. And I feel like what we're continuing to see, and I spent most of my career in acute, primary, and specialty care environments, we're seeing a huge shift from that patient experience to a human experience. And so when you think of the connectedness of all these devices or all these opportunities for us, there has to be a way for it to be pretty seamless and invisible to the user. And I think about the importance of us being authors of both innovation and disruption. When you think about the core of all of that, it's about the experience, the connection, the value it provides, not just for the organization, but to the individual. And organizations that are more anticipatory in their needs of their patients and their consumers, they're stepping up and leading the pack. You think about things like in-ear monitoring as well. So if you need a continuous monitoring of how well someone is doing, sure, you can have it on your wrist, other wearables, but you can put things into somebody's ear, so it's even less invasive in some cases. And you're seeing the front loading of causality of disease by better understanding lifestyle choices. So yes, I need to sleep more. Yes, I should eat more cake. Yes, I need to get more steps in. But understanding the causality and the lifestyle choices that our patients or consumers are making. And there's that other piece of like, somebody may not be a patient yet. They may just be a consumer. And so if we can layer in the ability to bring technology to the forefront so that you can use something like artificial intelligence to get reminders to patients to help them take their medication very specifically at the right time frame, knowing who's high risk and where you can do intervention and trigger the staff to get in front of it before it becomes an issue. There's that space. You also think about the voice command and the ability to be able to search for healthcare using, I don't even want to say her name, SIRI, because she'll pop up on everybody's phones, but really be able to say, hey, I'm having these symptoms, this thing is happening. Healthcare is local, and we know that. And so how do you create that digital ecosystem around the locality of where your patients and consumers are? And I think lastly, as we talked about what each of us are bringing into the marketplace, you can really treat some of these needs through things like virtual reality and an immersive experience for people to tour your facility, learn your product, or cope with pain or chronic conditions. All of those things are really at the forefront of what allows us to bring the modern technologies forward and still make them accessible, and the wraparound for integration in our lives that truly is invisible. And if it's invisible, you'll use it. Or if it's easy to use, you'll do it. Just like exercise, do something that you like. So if it's walking, go walking. But if you hate to run and someone prescribes you a program for running, you're absolutely going to do nothing versus even going out for that walk.
Yeah, totally. I love that point. And you're so right. To extend that, what you're talking about a little further around just the technologies available to us, I think that so often in healthcare, we're so focused on how care has been delivered that we miss that consumers have totally moved on the way they live their lives. And so bringing these technologies, to your point, like virtual reality, augmented reality, smart texting, things like that, is really an opportunity to engage people with, frankly, the way that they're already being engaged by other sectors. Sarah, sticking with you, I'm really curious. One of the things you mentioned with silver sneakers is how it works with MA plans, and I wanted to talk to you a little bit about sort of the reimbursement cycle there, and in particular, how in a value-based setting, kind of a fitness health program like Silver Sneakers drives meaningful ROI for your clients, because a lot of times, when you're taking those value-based care programs, it's focused very much on reducing administrative costs, or adjusting RAF scores. But here we're actually talking about real proactive value-based care health, which is where I personally prefer to focus my efforts. I'm just curious if you could talk about some of the outcomes and results that you're seeing with the program, and why your clients really love using the solution.
Yeah, absolutely. So you think about the fact that the primary goal of implementation of value-based care in healthcare was centered on quality, but organizations started to see a tremendous benefit in operations and reduced cost. We recently had a study came out that showed that members enrolled in Silver Sneakers programs not only are admitted to the hospital less often, they also have a shorter length of stay and less chance of being readmitted as well. And that all comes down to a lot of the analytics that we have and the greater visibility into both our cost, our risk, and some of those patient outcomes. And you think about, we have an improved ability to track effectiveness of the strategies in value-based care. We have an opportunity for reducing costs across organizations. Even insofar as when we work with some of our partners, better estimation of potential costs and transparency into those outcomes that they may expect. But historically, a lot of the challenges have been either poor incentive structures, or the ability to actually implement things well. And so we use predictive modeling to help incentivize the structures for what we know will actually work. And it's highly dependent, I'm saying in some cases, on applying these to large amounts of data that have to be deeply integrated for analytics. And when you think about the challenge of that in the healthcare sector, bringing all these different types of data together, it can break privacy laws, it can create a data breach, it can damage patient trust. So we have so much energy that goes around making sure that we have quality, lineage, governance, opportunity, aggregation of all the data sources that we have. So when we partner or share those out, we're doing so with a level of confidence that is not something we have historically been able to do before.
Yeah, that's extremely interesting, and I love that the stats that you have around the folks who are active in Silver Sneakers actually lowering utilization, which is the key to value-based care, and what I'm most excited about over the last couple of years with the MA plans and direct contracts and other things that we're seeing. I'm curious, Sammy, same question for you, slightly different, slight tweak, which is, you mentioned that payers and or direct employers will pay for this for their members. How are you engaging with them on the payment side of that, to make those solutions, to make your solution free for the actual participants?
Yeah, so sadly, I guess most innovations in healthcare, at least clinical innovations, are health promoting or outcomes improving, but then more expensive, like a new cancer drug. And then you have this crazy trade-off of, wow, it's $1 million, we extend life by 9 months. Are we going to pay, or what's a fair price? That's a dilemma in a lot of healthcare. But when you reverse a chronic disease like type 2 diabetes, it's kind of a miracle thing. You save money and you literally improve and or save lives. So that's really our value proposition to, we work with self-insured employers like Home Depot or Comcast, our customers, and several hundred now. Health plans like Blue Cross Blue Shield, North Carolina, which actually is where you are, Drew, in North Carolina, and even government entities like VA and state entities like state of Alabama. And so our value proposition is simple and say, you are battling with type 2 diabetes. It's obviously very costly. It's costing about $400 billion a year in America. You benefits leader at an employer health plan. How about we come and fix that problem for you, and you actually save money in the process? How does that sound? And by the way, we only get paid for results. If there's no results, you pay zero. So I've tried to, and we've tried to, like, eliminate any excuse to not work with us. And then obviously, we're now about 6 years into our journey. So we have quite a bit of data. And since Sarah shared some numbers, maybe this is relevant for the listeners. We did a millimeter validated analysis with tons of our employer customers from real medical claims, not hypothesizing savings, but real claims. And it came down to about $425 per patient that we treat per month. So within the first year already. So multiply that by 12, you're looking at $5,000 of actual medical claims savings within the first 12 months, while you actually reverse the disease. So it's a kind of a beautiful thing where we align the money and the business model with outcomes that the patients love. And I'll finish just with one thought. One reason it's very easy to quantify, and it's also very quick, is these diabetes drugs that people are on to manage their disease forever can easily be $500, $600, $700 a month, like insulin and SGLT2s and GLP-1s. These are ridiculously expensive branded drugs. And we typically get patients off of them in 30 to 45 days. So it's that rapid. So, and as an immigrant, this is sort of a one thing that's been slightly painful for me to learn, but if you don't make people money, in US healthcare, good luck trying to commercialize. So when you align the outcomes with the money, magic happens.
Yeah, that is really, those are some very impressive stats. And honestly, I don't know why everybody hasn't contracted with you yet. You certainly have answered a lot of the very specific, a lot of the specific challenges, I'd say. I think that, what is most interesting to me about what you just shared, in and of it all, just because of how the healthcare system works, is one of my biggest frustrations with the shift to value is that we're still stuck in these annual cycles of healthcare reimbursement, even in the value-based care setting. And it's sometimes hard with long-term care and chronic disease that somebody has for their life to show meaningful results inside of an initial 12-month period. So the fact that you're able to show those cost reductions so fast and get people off of their medications so quickly, I think is just really tremendous. So kudos to you on that program. So, hey, Tom, I wanted to switch over to you really quick and certainly add any thoughts that you have on this, but I wanted to touch on something you said earlier, which is, kind of the tiny habits side of things and getting folks really engaged in these healthy activities. And I know a lot of it comes from personal motivation, right? It's impossible to really create meaningful behavior change without somebody signing up for wanting to do this. But I'm curious, on your thoughts on what are the opportunities using advanced analytics and AI and sort of, smart interventions to help folks start to make those choices and implement those tiny habits from your background and work. What have you seen be effective there?
Well, I'd say what is effective all the time are nudges, because tiny nudges next to tiny behaviors in those moments really do seem to work. So, our self-awareness is pretty low. So anything that is able to extract information from a sensor network that then can be learning us, watching us, helping us, that could nudge, most importantly, at the right time, because those reward centers in training that positive behavior, and it can't be done in retrospect, and it has to be done in a very, very thoughtful way. Because I think, certainly in my experience, in that sort of border between well-being, healthy, and healthcare, where we've tipped to the wrong side of healthy. We look at data as if every consumer understands that their job is now to be a scientist of their own lives, and they're not. Most people have been taken on this journey where, from school to adulthood, say, where you go from telling, you're told what to do by your parents, and then teaching, which is where you learn knowledge at school, to then, if you find what you're good at, coaching, where you have now a better environment of support, to ideally then shared experiences where you're a member of a community, and actually the community just sort of has the behavior become inherent to your day-to-day. So if you sort of tip AI or some kind of learning capability over the top of that spectrum, what you would start to notice is that the support structure is not there for everyone. Coaching and shared communities really, really work to get those behaviors really thriving and fluid. But what we kept doing is we just kept the teaching thread going. So all we did is we throw knowledge at people, we throw data at people, and assume that they understand or know what to do next. But even the most elite athletes, what do they employ as their number one most important partner? Is a coach, because they can't see and understand all the data that's coming at them, which might help them to find that 0.01 seconds, that 1% or 1.5% better, that makes the difference between a gold and a silver medal, per se. So yes, I think that there's just something very important. It's not so much that AI has to be there, it's how do we make sense of the data that AI then can be doing to nudge us in those moments. So sort of keep it simple and keep it closer to those brilliant basics, rather than serving what's sort of the worst part, I guess, of human behavior, which is the thing that we will actually do is go after a quick fix. We'll more sooner take a pill or rub some magic potion all over our bodies. Or then maybe the next one, will probably follow some sort of faddy program, a 7-day cleanse or a 30-day something. But really, we know the brilliant basics actually work. They work not just to treat a lot of these problems, but more importantly, and for more people to avoid a lot of these problems. Like a lot of these chronic conditions could have been dealt with if people had a high support structure to manage those good behaviors and keep nudging them in the right direction. And as we were taking more and more responsibility for our own lives. So yeah, it has a place to play, but data is not the be all end all.
Yeah, totally. I think that's a great point. And I think what you're saying is really resonating with me as I'm thinking about our culture, which is oftentimes very much one of that's okay. I can do it myself, and if I can't, just give me the easy solution. And like frankly, health behaviors, especially sustained health behaviors, it's not that complex, but it's not that easy to do, right? Because it's all about repeated behaviors over and over again. And so I think that that the nudges, I think, makes a lot of sense. Sarah, Sami, anything to add really around sort of what Tom just shared, or anything around how you're applying analytics specifically inside of your solutions?
Yeah, what's interesting about what Tom shared is there's a component that analytics actually don't touch. And the reason I believe that's such an important thing to share is that social connectedness and that bout of not making sure that people aren't lonely is huge. And we just did our Instructor of the Year awards for Silver Sneakers. And we've got fitness instructors who do classes live, and they also have gone virtual for a lot of their members. The instructors of some of those groups have been with their members for years. They know everything about that person. They know their birthday, anniversary, families, dogs, cats, illnesses, preferences, where they stand in class for Zumba or yoga. And they have all of these amazing celebrations. It is an absolute social community and continuum of that aspect. So the fitness is a big piece of it. That's what brings them together. And yet they are absolutely intertwined by the human connectedness of what is brought forward. And so for all of the amazing analytics and information we have about our members, the relationships that we have with the instructors who lead them in their lives on that journey is proving to be one of the most important factors that we have. And so keeping that connectedness, even with our own employees and colleagues, is absolutely instrumental in being able to really dig into the wellness aspects of everything happening in our members' lives.
Yeah, I'll mention, sorry.
Oh, I was just going to say, the great point I'll say about that, Sarah, is that just really quick, is that I think in the social determinants of health, who you spend time with is actually more of a determinant on your health than who is your healthcare provider, right? Which I think is so interesting. Sorry, Sami, go ahead.
Yeah, so I was going to mention two things around sort of data and AI. And so while everything what we do at Verda is fully virtual in that we never touch our patients, obviously we are a provider-led clinic, but it's fully virtual and we collect data. So data and AI is absolutely at the center of what we do. That said, there's sort of two counterintuitive things, because people oftentimes throw the AI buzzwords and ML buzzwords, especially when they're raising money for their companies. And the two things are, one, the patients, the users could not care less what's under the hood. They care about the experience with the coaches, with the providers, I mentioned I'm an immigrant. My mom lives in Finland. We FaceTime. This is an iPhone, and I used to work for Nokia. This is ridiculously complex piece of machinery. There's lots of AI. My mom could not care less. She just wanted to be an easy way to communicate with her son, and she loves that. The more there's AI, the less she likes it. So that's just the one thing in terms of building experiences. And we call it giving superpowers, or AI gives superpowers to our coaches and providers, so they can allocate their time appropriately to give the very kind of empathetic human experience for our patients. That's one. So we try to hide all the AI. And then the second thing is particularly addressing a disease as a treatment. I sometimes see these press releases like, oh, we're going to use big data to figure out how to reverse or improve type 2 diabetes. I'm like, good luck. We're already doing it. And so it's very important to understand, or try to understand, the biology, how the human biology works. So like in our case, we started from, and my scientific co-founders, from the knowledge of how does the human biology works, how do you actually reverse type 2 diabetes, what's the role of insulin resistance and inflammation, and how do you lower those? And then understanding that, as opposed to throwing bunch of data and then you're cutting trees in the wrong forest. So the danger of AI is that if you don't actually understand what you're supposed to do, you analyze, throw things into a model, you get something out, and then you're sort of repeating something that actually isn't going to lead to the right outcome. So I just wanted to highlight two kind of counterpoints to the overwhelming love of AI that's now happening in digital health.
I love that, Sami. And just to underscore that the story about your mom caring less about what's in the iPhone, but the fact that it works really matters. I think that's ultimately what is going to help healthcare be most effective, right? Is when it just works. And a really quick example, one of the best user experience lessons I ever got was actually at a conference, probably almost 10 years ago now. And there was a company that was very early, way ahead of its time, has since flamed out dramatically, but now there's companies trying to do what they're doing in true, technology, sort of the technology cycle. But they were building a continuous blood pressure monitor that just used a light sensor on the wrist. And they had in the watch, on the watch face, they had the continuous blood pressure reading. And the user experience feedback that they got from the people, the consumers who were in their testing program, was, hey, look, I love the watch. Like, I'm super glad that you guys are doing this research, but can you change the display so it just shows the time? Because I know I have hypertension. Like, I know my blood pressure is high. That's not news to me. But when I'm in a meeting and I want to check how many minutes I have left in the meeting, I don't want to be seeing that my blood pressure is spiking. I just want to know the time. And I think that's maybe a real lesson and takeaway that we can leave with this, which is, there's a ton of great things happening around consumer engagement, but at the end of the day, maybe we should think more about implementing health technologies in the way that consumer technologies have really implemented their technology, which is don't show the what's difficult about things by showing the data to the people. Just show what works and just show what can be engaging to them, and let all of the technology be in the background. So maybe that's a great way to end. And with that, Sami and Sarah and Tom, thank you so much for the opportunity to chat with you today. Really appreciate it. And looking forward to connecting again soon.
Likewise, thank you.
Thank you.